Welcome to our webinar on sequences and social narratives. By using these two tools correctly, we can bring calmness to the mind of a child on the autism spectrum, as they provide concrete information and direction to their surroundings by answering some unasked questions. I'm your presenter, Saima Jaz, joining you from Nanaimo, British Columbia, located on the beautiful and traditional territory of Snuneymuxw First Nations. Saad is assisting me, and you're welcome to send your questions to him anytime during the presentation. I will address those at the end. An overview of the topics for the two important developmental tools: stepwise introduction of the sequencing activities, including daily routines and introducing some new ones; building comprehension and answering what, when, and where questions; use of visual boards for communication, planning, and storytelling; what are social narratives and different modifications for the same story that's required for the folks across the spectrum. And then I'll share some online resources and some of examples, my own examples. Developmental curriculums carry use of everyday and sequences that are seen in the nature for teaching skills like literacy, language, communication, and social interaction. Typical children often pick this up very early and can order a sequence by the time they are in preschool or kindergarten, and through that, they learn to tell a story and plan an activity. Similarly, sequencing and social narratives are essential developmental tools that are frequently used for children on the autism spectrum and related disorders. However, as it's true for any tool, there's a correct and an incorrect way of use. And unfortunately, it's the incorrect way that's more prevalent in the autism world. So let's find out how to use these tools correctly. Before a child can tell us a story or even put events in order, they require an understanding that things happen in a specific way, that there's a cause and effect or before and after. For majority of our children on the spectrum, the concept of cause and effect seems to be missing. In that case, start with two-picture sequence about a familiar daily activity. Finding two picture sequences that go in only one direction is difficult. Like in the first example, is the child taking a bath and then getting dressed or undressing to take a bath? So this one can go either way. One-way sequence is more like the second one. And using arrows to indicate the direction or the flow of events is also a helpful visual cue. In one of my earlier webinars, I mentioned that first and then is extensively used for structuring activities at home, therapies, and at school. Mostly it's used as a motivational tool for pairing up a visit or a task that child is not too keen of with a favorite activity or place right after, like going to the playground after a doctor's visit. First and then is also a great way of communicating a plan in a clear and concrete way. It tells a child what to expect next, and it eases anxiety and makes transitions less stressful. But if we use first and then for compliance training by holding off what child is longing for, then it's not correct. Or if a preferred activity is denied, because the child has decided not to follow through with the first one, then it's also unfair and seeds defiance. Once child has a concept of two-step sequence and the direction of events, you can step it up to 3 pictures, which are much easier to find. I would start with the sequence the child can relate to more and use labeled picture cards by just adding text to the images. In the beginning, you don't have to quiz the child and can always go first, show him the order, and then ask the child to do the same as his turn. Explain each picture with 1 to 2 words that you may have used as labels. If you've already used the sequence for teaching a skill before, like brushing teeth or washing hands, then I would use those images for the child to place an order. And if the child can verbalize, then encourage using a word as they do that. Pictures and words can be different for each child depending on their level of understanding. For an early learner, I might begin with sequencing images of just a toothpaste, a toothbrush, and a cup. And once child has done that, then switch to the set of pictures of squeezing out of paste onto the brush, brushing teeth, and of rinsing mouth. I also like to use numbers instead of first, then, and next while teaching sequencing, along with sequencing of text card with the pictures, as this helps the child associate word to images. So we go from labeling the items to labeling action words: toothpaste on brush, brush teeth, rinse mouth. Pictures can be drawings, realistic, or actual pictures of the child and his toothbrush paste and the rinsing cup. You can teach an important skill of answering questions here as well. Ask, what is this for? Or what is this for his toothbrush or the cup, and help him answer verbally or by touching or handing you the word card. Another question you can ask is, what is the boy doing? Again, guidance for echoing of the words, pointing, or a combination of both, of brushing teeth. All children on the autism spectrum do well with pictures, you know that, but they do even better with words. Another daily sequence is of washing hands. First set of words could be water, soap, rub hands, water, towel. Again, echoing, where you provide the word first and the child repeats, would be a great start. My next set of words for describing these pictures would be action words or verbs. Wet hands, use soap, rub hands, wash hands, dry hands. Here's a daily sequencing activity that you might already have used to help your child getting dressed. Again, the text changes from just naming the items to a simple instruction of put on shirt, put on socks and shoes. Such an activity also helps different people helping the child over the day by being consistent with the use of the same verbal cue, which would be effective with or without the visuals when the child starts dressing himself. Let's take it further to how we can include the child in planning of his daily recreational activity with the help of a visual board. Let's assume that you're setting up 1 to 2 hours every evening, or no, not every, but let's say 4 days a week. You're planning to take him out for an hour or two. You have discovered that he loves the outing, looks forward to that, and is happier on the days that you take him out, but looks a bit sad or gets upset on the other days. So now you are going to ask his dad if he can do the same for a couple of days, and also going to check with a friend. You notice some variables and know that your child doesn't do well with changes. Time of the day for his outing is not the same for you. So you would like to communicate that with him visually, as he doesn't seem to remember when you tell him verbally. Person for the outing would be different. And instead of taking him to the same place every day, you are also considering a few other places. So this is the type of board I would recommend using, where you can communicate. If you'll be taking him that day, he will be going out in the morning, afternoon, or evening. You can add pictures if you want to. Then who would be the person taking him out? Mom, dad, or a friend? where he might be going to, and what would he do there. You can check off with your child early in the morning, select time of the day with a check mark, or you can circle, check off, like today it's dad's turn to take you out, and you can select the place first and slowly, ask your child so that if he wants to, he can choose one of those places. So in a way, now you have started to plan the day together, and he has the information that he is looking for, and you'll see that over the day he'll be more patient and with this bit of information. As he the routine goes on, he gets more tuned in with the board, give him more authority of picking up the places or picking up the activities, or if possible, even time of the day. So, and then another thing is, once everything has been checked off, he can share it with the rest of the family to let them know what did he do that day. As I believe that a child should be able to choose and plan his outings and share his story before we expect from him to get interested in other stories. This format will work better for a child who likes and understands words. There are a couple of more names here. Could be someone from the family, friends, or a support worker. More places in there, and also activities. You can use this board for asking and answering questions as well, like where do you want to go today? Who went with you yesterday? Who's going with you today? What did you do there? Teach the child to answer by using words, spoken or written, with the check marks or circling. Now, adding on to your desk activities, you can start using sequencing workbooks. Some you'll find come with just pictures, and others with picture and text. And, you can always jot down the words yourself. You can also incorporate cut and paste activity along with the sequencing. For a child who likes to color and can print, I just love this format as a way of connecting a daily sequence with written expression. Let's see if we can use sequence or a social story for making a grocery store visit better. A child who can read and comprehend might benefit from this social story that I got from an online resource. And so he learns and understands what to do at a grocery store. But what about the child who can't read, or who can read, but he doesn't understand what he's reading? Are these pictures enough for conveying the message? So that's how I will work on this story or any other story. For this one, I would start by using labeled pictures, one of the grocery store entrance, a basket or a cart, a picture of picking an item in an aisle, and a picture of a cashier or self-checkout, and one of the store exit. Then help the child sequence those pictures, just like using the top sequencing strip. This would be enough to convey to the child what to expect. But now you can use the same pictures and create individualized stories by pairing it with words, phrases, short or long sentences. You can work with this in multiple ways. First, like I said, you just teach the child how to sequence pictures horizontally. Then you can use the chart on the left side and teach the child to sequence the pictures vertically, and just say the phrases that are just would be next to the picture. Uh, then you can use the chart on the right side, sequence pictures vertically, and then match the cutout phrases from the chart or from the worksheet, whatever you want to call it, on the left side, and pair it with the pictures on the right side. The next step would be that sequencing pictures vertically and then copying the phrases. If child has the fine motor skills, or even if he's learning, you can help him do that. So you copy the phrases on the chart on the right side. And then comes the part where he sequences the pictures and then jot down, so in 1 to 2 words, what the picture is about. So you can see that it would be a smooth flow. I made this board for a youth who likes going for short walks with his sport workers. He can print a few words and is learning to tell time from his watch and iPhone, which he enters on the sheet. Sport worker later tells him how much time he spent on the walk. The board serves the purpose of daily documentation of his physical activity, which is one of his goals, and he proudly shares that with his friends and family. A similar board for encouraging him to use indoor equipment during winter and the days that he can't go out for his walks. There he can pick time of the day when he wants to use the equipment, which one he would use that particular day, the start and the finish time, and then with help figuring out how much time he spent. With these sheets, you can ask questions about when did you exercise today? How much time did you spend? Coming to the social narratives, it's an evidence-based learning tool designed for use with people with autism, on the autism spectrum disorder and other associated disabilities. Social narratives often use personalized stories to teach a skill, identify a situation, or tell a narrative. Some examples of social narratives may cover topics such as experiencing a new place, person, or an activity, or getting along with others, interacting with others. It is referred to as a story or a written explanation that tells the learner not only what to expect and what to do, but also what the situation is, with the goal of addressing the challenges of learners finding social and new situations confusing. Social stories, social scripts, comic strip conversation, and are all different types of social narratives. So with these, we share information by answering what questions, when, where, how, why. We also make sure that it's written in a positive and reassuring way. And it's written usually as a first person. I prefer that person name is used in the story. You can choose to write in full sentences, short sentences, or phrases. These narratives can be created with or without pictures, depending on the visual cue, how much of that the individual would need. You can take digital pictures, use online ones, or simply draw what is needed. You can also make use of picture symbols from a commercial program such as BoardMaker. In short, social narratives provide social cues and help correct individual responses to situations in a non-threatening manner. You can search these by topic on many online autism resources, like a couple that I've shared over here. I already shared an example of an online social story of going to a grocery store and how you can make one on your own by looking at the sequences, deciding what sort of a text you want to use. Is it going to be words, phrases, or sentences? And just don't stick to reading it. You can incorporate role playing. You can, and I really direct children towards written expression, even if they are verbal. You may find several social stories on various topic online, but maybe not the specifications that you're looking for. And for that, I encourage families to learn how to make their own stories based on their child's comprehension and their individualized concerns and issues. When I check the most used stories in the school system, I find those to be around social interaction and about avoiding certain behaviors. It is important to understand that a story alone is not going to stop the child from biting his hand unless we figure out why he or she is so much disturbed or bothered and try to remove that deterrent, relax and de stress the child. Again, a story alone is not enough for taking care of the socialization through scripts, and we have already covered this in another one of our webinars, that understanding and acceptance is required for socialization for every individual on the spectrum. And this understanding, first, it's for the families, um, unfortunately, by the professionals and other concerned personnel as well. I have social narratives covering so many diverse topics that go beyond the usual list and about situations that we have come across. And all of these can be modified for um, folks all over the spectrum based on their level of comprehension. Some of the narratives that I have worked on are winter storm, power out, a very hot day, washing hands, COVID shots, it hurts, visitors, dentist and dental hygienist, doctor visit, hospital visit, tooth extraction. These narratives, along with dealing with the particular issue or situation, have also opened for me opportunities to connect with the subject at a deeper level, and many times resulted in immediate responses, which are always encouraging. I'm going to share a few of my narratives with you, starting with the ones that I wrote for my son when he developed extreme sound sensitivities at school, resulting in his self-isolation. And later again, when a similar situation reoccurred during his mid-teens. I'm sure you will be able to appreciate the difference in the two stories. Then there are a couple of more along with visual boards about two common scenarios that I've come across for individuals with moderate to severe forms of autism. So during the periods of self-isolation, my son didn't just refuse to leave home. Also, he wouldn't let anyone visit us. He was in a hyper alert phase and could tell when a car went by our place or turned into our driveway. He would run to the window to check who's there and rush to make sure that the door is locked. He would scream, jump from the top of stairs, and hand bite if we let anyone in. So I worked with him to a point where he was able to accept short visits from well-meaning, quiet folks from our close circle. And this narrative was a part of that preparation. The story Visitors with pictures and phrases reads, friends of mom and dad, Kasim use headset, say hi with fist bump, listen to music and wave by. This was done when he was in primary school. It can be further simplified with just 1 to 2 words with actual images and a different background to reach a person with lesser comprehension and contrast sensitivities. Now, this story is when he was around 15, 16 years of age. It's the same message as he was more or less in a similar state of mind, but with a different format. Here I use just one generic picture, and the narrative is based on sentences that are a little different from our usual sentences and not always grammatically correct, but more understandable for him. And that is the main objective. So this one reads, as some days we have visitors, they are friends of mom and dad. They come to talk to mom and dad. I can use headphone and play music. Some want to say hi to Kasim. They know I want no talking. I can smile and give a fist bump. They will stay for a minute and then say bye. So the smile never came up when he would give the fist bump. He would always look at them, but he was okay with the visit and he would promptly say bye to them. So, you can go now. Thank you. It was also important that the visitors knew about the story as well. So they would be aware about staying silent in his presence and using relatively quieter voices during their stay. Next one is about washing hands. Many times you find that it's easier to teach and maintain something simple like hand washing with a sequence when they're kids, than maintaining it later when they become teenagers. And a story about getting rid of germs, staying healthy, or to not get sick instead of the ones that talk about sticky or dirty hands work better, um, eh, according to my experience. So really simple one, washing hands is important. We wash away germs. Washing hands keep us healthy. Clean hands feel and smell good. Use soap, rub hands, then water wash. Use towel to dry hands. And here's the story that would work for a nonverbal who can read and understand simple sentences, but needs help asking for support otherwise. So some days I feel pain, head, tummy, or back can hurt, tooth, ear, or throat can hurt. I can point and show where it hurts. I will take medicine. It will help me feel better. I may have to go see a doctor or a dentist so they can give me a better medicine. When dealing with level 3 spectrum children or adults who have high pain thresholds, communicating early signs of being unwell are easily missed, and communicating even moderate to severe pain is such a challenge. It's always important to rule out pain as a reason of their off days or unusual outlook. First, when it comes to teaching feelings, I try to build understanding for more than just emotions and include hungry, thirsty, sleepy, noise, hot, cold, along with pain. So, any of the things that would cause discomfort and not feeling good. I try to help them understand meaning of each of the word with the help of obvious situations, movies, YouTube, social stories, and visual boards. Now, with this visual board, you can encourage the person to point, say, fill in the blank, or circle a picture for communication in a way of reaching out for help. Similarly, using this board, the person can say, point, fill in the word, or circle to let you know where he might have been. And you can always add more pictures to the board. Once someone has successfully done that a few times, you will see that they will take the next step on their own. They might just approach you, see a word, and point directly to where they are feeling pain. So I hope you found the presentation useful. Do we have any questions, Saad?
Yeah, we have 4 so far. Our first question is, my daughter is a high-functioning autistic who seems to dislike social stories. Do you know if other folks on the spectrum share this view?
Yeah, if you ask adults on the spectrum, they will tell you that they dislike the generic social stories used for them as kids to modify their behavior. Actually, dislike is a milder word. They will tell you that they hated those stories. These stories encourage the child to be more like their peer, to seek their approval and approval of the authority figures, and to take responsibility of how others treat them. Some of the stories tell children how they're supposed to feel. Your daughter has a voice and is saying it for not just herself, but many others who either cannot or rather not say that. I would ask her how she would like to word one of the stories that she dislikes.
Yeah. Our next question is, can you share your visual boards and the social narratives with us?
For sure. Kindly put your email in the chat or send me an email later and let me know which one of the boards or story you would like to have, or if it's all the stories that I've shared today. I will respond you in a couple of days. I also have some stories for visual boards and sequences on my account at Boardmaker site. So you can search me there by name and download from there as well. So those stories and sequences are different from what I've shown you here. I'm also considering uploading some more stuff on my website in the coming months for more direct access.
After your presentation, I'm a bit confused about the right way of using first and then visual. Can you explain again what the correct way to use these are?
So first and then can be used for planning activities, transitions, and that's quite straightforward. But I think it's where we use it for motivation. We have to make sure that the hesitation is seems to be coming out of boredom, and the child is not scared. Like have to figure out what is it. If it's like a slight anxiety because of a new situation, then it's fine. It's not to be used as a compliance training tool. So some of the simple ways of avoiding that is making sure that first is not an activity that the child is adamantly refusing. So we need to figure out what is the reason behind it. If he seems too scared, if he just gets so angry. So not forcing him into something without figuring out the reason. Then should not be an activity that the child doesn't normally get to do, and you hold it off as a reward. So something that he prefers, but he doesn't get it unless he does this thing first. And this then also should not be dependent on the first in a case like if you say, we'll go to the playground after school, and it so happens that the child has missed the school, and then you say, oh, we're not going because in school was missed, and so we're staying not going to go to the playground. So do not try to punish.
Right. Our last question is, I support many individuals on the autism spectrum and would like to make specific social stories for them, but I'm a little unclear about the steps. A specific scenario I had was a child is great going to the grocery store, no problem, but they have issues once they get to the cash register. Could you give me some pointers on that?
Definitely. Let's go back to that slide. Okay. So he's good with going in, and like you said, it's coming to the cashier. So a couple of things there. Usually it's a little crowded. People have to line up, and they are talking. You move slowly. Um, One thing could be that in the beginning, if the child is too hesitant and two of you are going, like if you're going as a family for grocery shopping, then one of the parents just waits close to the exit door, or try to use the self checkout, which is usually faster. Um, Instead of the cashier side. Uh, and then I'm thinking maybe it's the beeping when you're trying to scan. It's that sound that he's hesitant about. So, and I wonder if you've tried now noise canceling headphones for him. So, couple of things to think about in the sequence. And maybe you can put in headphones, and then instead of the cashier, use the self check and see if that makes a difference. But I would really like to talk to you more on that. I have a few more questions, and I love it if we can connect by email. I hope what I said just clarified a little bit for you.
That's all my questions.
Okay, thank you, Saad. Link of the recording will be available on the education page of the site within next few days. Please watch it if you need to and see if things are a little bit more clarified. But if you have a question, drop me an email. Then thanks again for joining us today and have a great night. Thank you.